Hey guys, Tony Maritato here. So let's have some fun looking at 4 websites. I reference these websites a lot for different comparisons. And specifically, we're going to talk about your unique value proposition, unique selling proposition. What makes you different? So I talk to a lot of therapists, and a lot of therapists like to position themselves as the provider of one-on-one therapy services. They try to position themselves against the larger, more corporate clinic as saying, you're not just another number. We do one-on-one, we pay attention, customized services, all of this kind of stuff. But we have to step out of our own minds and we have to look at what is the consumer seeing. Because from my perspective, the consumer doesn't care. You're assuming that the consumer has had a negative experience at another physical therapy practice, which certainly we all hear those stories. But I would say that's probably a small minority of the people that are potentially seeking physical therapy services. I would say that when we're focused on those things, we're trying to speak to a tiny subset of the population who has been to therapy somewhere else. They weren't happy with therapy somewhere else. And it's even a smaller population because these are individuals that, despite being dissatisfied with the other therapy provider, they're willing to try therapy again. So it's a fraction of the population. Rather than focusing time and effort on that, let's take a look at the general population. These are individuals that have never been to therapy, or if they have been to therapy, they've probably had a fine experience. Maybe it's not as great of an experience as coming to you, but it was good enough that they were willing to go back again. And so looking at first impressions, and we know how powerful first impressions are. I'm not poking fun. I'm not trying to be, a critic. I want to look at this with a beginner's mind and a beginner's eye so that we can start to improve the messaging we're sending. So this is Ron Miller down in Orlando, Florida. He does an amazing job. He has an amazing cash practice. I mean, he is truly one of the leaders and innovators when it comes to cash-based therapy services. So when I go to his website, and he does an incredible job with his website, this is the homepage. I haven't dug any deeper, but right off the bat, we have Get Back to Life. We solve the root cause of your pain so you can get back to what you love. Book your evaluation. And then we've got some beautiful stock photography, kind of young adults here. We have some testimonials. We have real pictures of patients, and I'm assuming that's one of the therapists that works with Ron. Beautiful colors, well designed. He's got an embedded video, more real photos. There's Ron in the middle. We have some social proof, which is awesome. His affiliations, accreditations, I think this adds huge value. But pretend you don't know anything about Ron, right? And so then we have a little bit of meet the staff, which is great. He's got an incredible team. Pretend you don't know anything about Ron, and there's no difference in your mind between these therapists. Now, let's go to a more corporate-based therapist. So now or therapy clinic. Now we go to Athletico's homepage. What do we have here? Tagline, it starts here. Physical therapy is often the thing you do after medication, x-ray, surgery. The best way to treat your pain is to start where you normally finish with physical therapy. Request a free assessment. Pretty similar. Right? And then again, we've got a real therapist, we've got a real patient, you kind of have a view of what's going on. We're growing, join with us, concerns about Corona, our services. You can see their services here, clean, looks great. Difference here is, notice, Athletico says we accept all major insurance plans. So I didn't necessarily see anything on Ron's about being cash-based, being insurance, any of that stuff, which is fine. What I'm saying here is I don't really see a difference in the consumer's mind between this website and this website. It's really pretty similar. Again, social proof, proud partners, physical therapy, real people, not stock photography. There is some stock photography in here, but I think Ron had some also. There's nothing that really jumps out as, oh, this is different, right? And then if we go back to another cash practice, again, Jared Carter, one of the founders, one of the OGs, like does an amazing job with what he does in the cash pay world. His tagline, we help active people in Austin to quickly recover from injury so they can keep playing their sport, exercising, and enjoying life. Awesome. As seen in all of his social proof. We've got an intro video. We've got an ebook, I'm guessing. Another little video. Really great job, right? Testimonials. There's nothing really here, I would say, that's dramatically different than if I go to an ATI homepage. And so here, our ATI physical therapists help you get back to your best. Everybody's saying the same thing. Everybody's essentially doing the same thing. Online physical therapy in the comfort of your home. ATI physical therapy. We've got some pictures of the front of the building. Now this is the generic website. It's not necessarily their city-specific websites, but real photos, real content. Looking at ATI physical therapy jobs. Notice both corporates are posting jobs right on the homepage, whereas both cash practices are growing their teams also. Less emphasis on hiring. So, you know, I just feel like we want to find a differentiating factor, right? We want to establish our unique value or unique selling proposition. The thing is, in the consumer's mind, if they don't know you and they're coming to your website, and this is just one tiny aspect of establishing your brand, establishing your message, but if they land on your website, I don't really see that much of a difference between your website and everybody else's website. Now, maybe you do offer unique services. Maybe your experience is unique, but the big corporates are kind of claiming the same stuff, right? And in the patient's mind, are they asking to buy one-on-one services, or are they asking to buy the solution? I think most patients who have never been to therapy or have been to therapy and had a positive experience, they just want the solution. They don't care if it's one-on-one. They don't care if it's with a PT or a PTA. They want it to be with somebody they enjoy, or at least somebody they don't dislike. Like, I think that really we should focus more on the experience, like the patient care experience. What are you gonna do? What are you gonna see? Show them into the clinic, show them around the facility, answer their most common questions, put their mind at ease before they ever book an appointment with you. Do that through video, do that through blog posts, and, you know, really dig a little deeper to try to find that differentiating value proposition. Because right now, I'm just not seeing it. And so what happens is the patient's left with the choice to say, well, I can go to this therapist who's in network, or I can go to that therapist and pay out of pocket. But what's the difference? You know? All right, guys, I hope that was helpful. I hope that made you kind of rethink or begin to think about your marketing strategy, your branding, your message, and maybe do a little bit of work to improve where it is. I'll catch you guys on the next video.